our next presenter is Gerald Mastroianni. He is an industrial hygienist and laboratory manager in Dr. Homero Harari's Occupational and Environmental Hygiene Laboratory in the Department of Environmental Medicine and Public Health at Icahn School of Medicine at Mount Sinai. And Gerald is also a recent graduate from the CUNY School of Public Health, earning his master's degree in environmental and occupational health science last year. So Gerald, it's all yours.
All right, thank you very much for the introduction. I appreciate it. I'm going to test to see if I have control here. I do. Okay, it's working great. Okay, so yes, thank you very much. I'm Gerald Mastroianni, industrial hygienist, here to present my project evaluating inhalation exposures to alternative cleaning products by Latinx domestic cleaners in New York City. So here's a brief outline of the presentation. We will start with some background on the issue, then we'll talk about our ongoing work researching exposure to cleaning products, our proposed work to evaluate alternative cleaning products and the limitations that we faced, then end with the Q&A. So a little bit of background on the issue. In 2014, Folletti et al. Conducted a systematic review of epidemiologic studies on asthma and rhinitis in cleaning workers. They found that exposure to cleaning products in various jobs and settings can increase the risk of asthma and rhinitis. Steps can be taken to reduce exposure, but it is more difficult in house cleaners. In house cleaners, there is lower worker education when it comes to risk and protective measures, and there is no health surveillance being conducted. Then in 2021, Arcangeli et al. Conducted a systematic review and found an increase in asthma and COPD in occupational cleaners specifically. They state that exposure control and worker surveillance is warranted for occupational cleaners. And both of these studies helped shed light on the health issues associated with cleaning. However, both of them lacked quantitative exposure assessment data. In this graph, we can see the amount of people hospitalized in New York State with symptoms after being exposed to cleaning and disinfection products from 2005 to 2017. 35% of all cases in New York were in just Manhattan and Queens alone, and many of them were seen here at the Selikoff Center at Mount Sinai. So this data inspired the creation of a larger study, the Safe and Just Cleaners. The Safe and Just Cleaners project has been exploring the working conditions of Latinx house cleaners here in New York City since its inception in 2018, including surveys, focus groups, surveying the cleaning product inventory in neighborhood stores, and exposure assessments. In this study, a survey of 402 house cleaners was conducted, and it was found that the majority of cleaners use products containing quaternary ammonium compounds and bleach. The survey also found that skin irritation, eye irritation, and asthma were common issues reported by the cleaners, and 98% of cleaners believe that the products they use negatively affect their health. So then in 2020, with the onset of the COVID-19 pandemic, disinfection methods were recommended in both residential and occupational settings, leading to a rise in the use of disinfectants. In May of 2020, the World Health Organization issued guidance on disinfecting high-touch surfaces. Then later that month, the CDC recommended disinfecting by choosing a product from EPA's List N, which provides a list of products recommended to kill SARS-CoV-2. About 50% of the products on List N contain quaternary ammonium compounds, and quacks have been linked to skin irritation, sensitization, dermatitis, work-related asthma, and other respiratory effects. A cohort study of female nurses with high exposure levels to quacks was associated with an increased risk of COPD, and reproductive toxicity and an increase in embryonic death has been observed in mice. So consumers want to disinfect their homes to protect from COVID and also may want to avoid the hazards associated with quacks. In addition to the known hazards with quacks, there is a lack of transparency with many of these products. Only about 55% of these quack-containing products on List N have a safety data sheet readily available online. So due to health concerns with the quack-containing products, consumers are looking for alternatives. About 15% of the products on list N contain hydrogen peroxide or peracetic acid, which are marketed as cleaner and safer products. About 67% of these products provide a safety data sheet online, which is a little bit of an improvement, but still not completely transparent. Hydrogen peroxide also has health effects associated with even acute exposure, including respiratory irritation and inflammation, eye irritation, skin blisters, and skin bleaching. And it's important to note that exposure during disinfection with alternative products has not been evaluated. Which brings us to the objective of the study. So this study will aim to assess the airborne exposures to hydrogen peroxide, peracetic acid, acetic acid, and total volatile organic compounds. Today, I'll be presenting the results of evaluating exposure to hydrogen peroxide and VOCs. So we conducted a pilot study here at Mount Sinai, examining exposure levels during cleaning with hydrogen peroxide-based products. In this study, 2 volunteers cleaned a bathroom and a kitchen set up here at Sinai using 5 products containing hydrogen peroxide. These products were selected based on their availability in local stores. 3 of them contained 2.4% hydrogen peroxide and 2 contained 0.8%. The products were used both with and without ventilation in each room. And here you can see the floor plan and the size of the rooms constructed for the bathroom and kitchen. VOCs and hydrogen peroxide were measured using direct reading instruments connected to the breathing zone of the volunteer. 3 areas were identified in the bathroom and the kitchen. We had the sink/mirror, toilet and shower for the bathroom, and countertop, stove, and fridge in the kitchen. And we collected area sample for 10 minutes after cleaning was done. For our instrumentation, we used the Pucaro PI2114 with a 16-port manifold to record hydrogen peroxide data. And we used 2 PPB Ray 3000s for VOC data. Here you can see a pretty familiar looking volunteer cleaning the bathroom with the monitors attached in the breathing zone, as well as the area monitors on the tripod. Here's a figure from our results. This figure shows the airborne concentration of hydrogen peroxide on the top and VOC at the bottom for the kitchen over the course of the 3 5-minute tasks. We can kind of see a slow buildup of hydrogen peroxide and a little more variation for VOCs on the bottom. This is exemplified a little bit more for the bathroom data. You can see the hydrogen peroxide build up over time on the top graph, and on the bottom, you can see it varies a little bit more by product. In this figure, we have box plots of the Kruskal-Wallis test with Dunn's multiple comparison used to compare concentrations of the 5 hydrogen peroxide products. This test is similar to ANOVA, but it allows us to compare if there is a significant difference between the median values. The thick line in the middle of the box is the median value in parts per billion, and the top and bottom lines represent the 75th and 25th percentile, respectively. The lines above the box plots show the significance of the comparison of median values between products, and the letters NS just mean not significant. This figure uses the same method of analysis, but this is for total volatile organic compounds. Here we can see more significant differences in medians between the products. And there were 2 things that kind of stand out about this graph. First is the scale of the concentrations that we're examining here. So the bathroom was smaller than the kitchen, and we can see concentrations about 10 times higher. And second, we can see that the VOC concentration was not dependent on the product hydrogen peroxide concentration, since products 4 and 5 were the products that were 0.8% hydrogen peroxide, had high VOCs despite the lower percentage. The levels of airborne hydrogen peroxide generated were above 1 part per million, which is the OSHA permissible exposure limit. That was over 15 minutes, not 8 hours, so we didn't exceed the PEL. But if this was an occupational setting over an 8-hour day, it is possible that overexposure could occur. 3 sessions did exceed the Hawaii and Washington State OSHA short-term exposure limit of 3 parts per million for 15 minutes. Backward. Okay. So in conclusion, alternative cleaning products are recommended, but their exposure has not been fully assessed. Our study provides the first initial data that needs to be confirmed by larger studies. Our study found high levels of hydrogen peroxide and even higher levels of VOCs. The higher the product concentration of hydrogen peroxide, the higher the exposure, but that wasn't always true for VOCs. When assessing exposure to cleaning products and disinfectants, we should focus on exposure to the mixture of all ingredients. Ventilation, as well as safer practices, are effective to reduce exposure, and more research needs to be done to understand the individual chemicals cleaners are exposed to, even when using alternative products. We did have some limitations with this. First, we only tested 5 products containing hydrogen peroxide. We had a small number of volunteers who were not professional cleaners. The cleaning time was not realistic to what an actual house cleaner would do. We also limited ourselves to only testing in the bathroom and the kitchen and no other rooms. The bottles were not weighed before and after, so the amount of product applied was not assessed. And again, a larger study is warranted to examine exposures to different alternative ingredients. Which brings us to our planned data collection. So we would like to build on the hydrogen peroxide study and address these limitations. First, we want to upgrade the kitchen and bathroom for the simulations. We will recruit 25 house cleaners to perform the cleaning task. The amount of product used will be recorded. And we would like to purchase new instrumentation. This would be the PortaSense D16 personal monitor. This monitor has interchangeable sensors that will allow us to assess exposure to hydrogen peroxide, parasitic acid, and acetic acid. We will continue to use 2 ppb rays to monitor VOCs. And we would like to develop English and Spanish educational materials to help inform the clients, the house cleaners, about safer cleaning practices. So unfortunately, our project has hit a bit of a delay, but we are planning on getting everything ironed out to start field work in January and complete it by April of 2024. We'll have the data analysis done in May and June, with our final report submitted in July. So that brings me to the end of the presentation. I have a few people I would like to thank. First off, I would like to thank the Occupational and Environmental Hygiene Group at the Senator Lautenberg Environmental Health Science Laboratory and the Selikoff Center for Occupational Health at Mount Sinai. I'd like to thank my mentor, Dr. Omera Harari. I'd like to thank our lab manager, Mahmoud Awada. And I would like to thank my teammates on the Occupational Environmental Hygiene Group, Daniel Aguilar, Josephine Dorsey, Dr. Angeline Danuel, Anna Gonzalez Romero, and Lucas McHugh. Thank you to the Department of Environmental Medicine at the Icahn School of Medicine at Mount Sinai. And thank you to CDC, NIOSH, Region 2, ERC. And thank you all for listening. I appreciate your time.